Dr. Stepovich, should a person still floss? Because you said something, if you do brushing correctly, flossing becomes literally unnecessary. Did you really mean that, or did you just say, a person should still floss, right? No? Yeah?
Okay, so my experience with flossing has been that if I ask a patient, show me how you floss, well, they only floss the front teeth. Now, if they're a good brusher, front teeth are two flat pieces coming together, and the in-between on the teeth is so small that if you brush properly at right angles and press, and you go back and forth, you get 99.9% of the teeth clean, and flossing the front teeth has no benefit. There's not, you can floss them and you get nothing on the tooth. Or the patient just pops the floss thread through the teeth and then brings it back up. That's not flossing. Flossing is sending the floss down between the teeth and moving it to the side and cleaning that tooth, and then moving to the other side and cleaning that tooth. And no dentist that I know of, or hygienist, really explains that to the patient. That's what they should do in their flossing. And I do, but I tell them, you have to floss your back teeth. Don't just do your front teeth. The back teeth have these great big contacts, but the front teeth have billiard ball contacts. Easy to keep, just with brushing take care of, but the big flat ones in the molars and bicuspid area, back in your mouth, that's where the flossing can be done.
You know where I kind of floss the most, and if I for some reason, because I'm one of those slightly sloppy guys left and right, and so I here and there find little excuses that 2-3 days the flossing for some reason didn't happen. I travel, I'm in airports, I'm this and that, and whatever. Or I come home very late, and I forget. My wife doesn't tell me to do it, for whatever reason, and there we go. So the point is, after 2, 3, or 4 days of not flossing, if I floss again, which I do, I don't stop for too long, I'm bleeding. Usually the second day I'm not bleeding anymore. So as soon as I start the second day, the third at the most, I'm again not bleeding. However, so let me tell you how I actually, what I floss. I don't floss so much the side of the teeth, here and here. I more floss right there at the gum. I press the floss down on the gum or up the gum, and I go left and right with it here, in whatever little space I have. I feel, and that's just my feeling, right? I feel that massaging the gum is where it's at. Not that teeth on the side. Let the dentist take care of it after 4 or 5 months, and the brushing and just, putting it in automatically a little bit, it does something anyway, but it's massaging the gum a little bit the way you said of working with the toothbrush, the gum hard. So basically in that area I seem to be doing what you say. So anyway, how bad is my flossing? Besides, never mind the 3 or 4 days I sometimes don't floss. Forget about them. I never said that.
Well, if you really want to get into what's going on in the mouth and what the problem is bacteria that are in your mouth. The bacterial population in everybody's mouth is really pretty high. If they don't brush, it becomes much higher, and you have all kinds of bacteria doing all kinds of strange things.
Right.
Bacteria are colonial. They like to colonize, and they communicate with one another, and they build a thing called a biofilm. It's like a little transparent ball that allows food to come in so they can be happy and fed, and they do their number 1s and 2s, and they push it outside the ball, and that out of that biofilm little colony, and they shoot that stuff out there, and that infects the gum tissues, and that's what's bleeding. Now, the biofilm takes over 12 to 15 hours to form. So if you can do something to destroy this biofilm and make ghost cells out of it, when in the studies of the people that look at these things, they call them ghost cells after you've pierced these biofilms. And they're just floating around, just the membrane of that little house that they were living in is there. So what you're doing when you're not flossing is you're allowing in between your teeth there, because you're brushing at 45 degrees. But if you brush it at right angles, you probably wouldn't have any of that. You wouldn't have that bleeding. But whatever you got to try that. But whatever happens is you break up those biofilms, and that's the thing that destroys and causes problems with gum disease. So if you brush twice a day and destroy all the biofilms that are in the mouth and make them ghost cells and float away, then you're really in good shape. You're healthy and you don't have bleeding. But now we're getting very technical with what goes on. Sure.
Just fast. Just answer me the question that I asked, because you haven't answered that to me. So number one. Do I have a major problem already? So I don't floss for 2-3 days, I start bleeding, but then it goes automatically away. So am I still probably in all right shape?
Yes, your body heals. The gum tissue, particularly in the mouth, it heals very quickly. So if you get rid of the biofilms, when you're putting the floss down there, you're piercing those. They're very fragile, those biofilms. Okay, good. So and then they leave, and then you don't have any bleeding for a while until they get back there.
Yeah, which is if I stop flossing, and because I brush wrong based on what you say, I brush in 45-degree angle, and in circle on top of it, so it's really screwed up. But, so now, what about me much more paying attention to the bottom of my, or to the top, to the actual gum area which I massage, rather than the teeth. I don't slide it down, up and down the teeth. I'm more like I push it up, and I floss the gums, not the teeth.
Okay, well, if you're stopping the bleeding after you're doing that, well, then you're doing something to get rid of those colonies that have gotten formed there because the food wasn't taken away. If you take away all the food, the bacteria then die because they don't have any food to live on. So good brushing removes all food particles and plaque that is not food. It comes out of saliva. Saliva has a lot of sticky stuff in it. And in the morning when you wake up and that slick feeling you have on your teeth is plaque that's come out of your saliva. Right. And it coats your teeth. And it gets into the sulcus. But it feeds the bacteria. So if you get rid of that and the bacteria have nothing to live on, you have no gum disease. You have zero bleeding.
So I suppose, if I would be flossing every day, actually I would have zero bleeding. It's just every so often when I leave it, then that's what usually happens. So now, just one more fast thing, and again, we're way over time here on that thing. You just said something about the saliva builds the plaque, and I can, my dentists, everyone I so far had, at least in the last, 20 years, said, Helmut, you need to come to me for cleaning every 2 to 3 months at the most. Why? Because you have lots of saliva. And then they always tell me it's very healthy. It's a good thing. It has just a bad side effect of building up the plugs a little faster. So you got to come more often. Does that? Do you agree? Concur with that statement?
We make about 2 quarts of saliva a day. And we recycle it by swallowing it. People that spit all the time. And I look at these baseball players spitting. They're depleting their body of electrolyte and they don't live very long. Athletes that spit all the time, they're really throwing away the minerals and things that belong in their system, and you should recycle your saliva by swallowing it. Anyway, but the salivary glands filter out of the bloodstream all the dead cells. Red blood cells live 28 days, and then they die. And some of it comes out in the liver, and works with the bile to make the bile out of the liver and the bile duct and gets into your digestive system. But the rest of it comes out in the salivary glands, and they put that into your mouth. Now, these dead cells have a lot of protein in them. And that protein makes them sticky. And they stick to the teeth. And you swallow it, and you give yourself back the protein that your body had used, and then it recycles. But if you remove that plaque from the teeth twice a day, I don't know, and if you brush it properly, I don't think that you need to see a dentist every 4 months or 5. Every 6 months is clean.
Well, I got that very obviously. Number one, obviously I brush it not the way you brush it. Number two, I brush it probably not enough. I told you my wife is still long brushing, and I already have shower shaves and everything else. So that's beside the point. That seems to be, perhaps a personal problem of not doing enough. But the question is simply, lots of saliva is good, but yet you have more plaque buildup, so you need to doing your brushing even better. Yes or no?
You don't want to, xerostoma is dry mouth. A lot of people have dry mouth, and they have all kinds of problems with their mouth because they don't have saliva. So the dentist says, you have good saliva, you don't have the problems that xerostoma people have. And they get a lot of cavities and gum line cavities and all kinds of things. But I don't think that having a lot of saliva means that you have to go get your teeth cleaned more often, unless you don't brush at all. But if you're brushing, and particularly brushing the way that I advocate, there's no reason to have to go have your teeth cleaned every 2, 3, or 4 months. You can go to 6 months.
Well, here's the deal. I will start brushing like you said, and then I'll report back to you in a year and see or at least in a half a year, and see what my dentist says. And he says, yeah, you're totally fine. And then I know that my brushing was off, and that's what all that was. All right?
Okay, yeah.